We don't use two antihypertensive from the same group in management. You always know that? Yes, okay, but I am here to say no. There's a particular group of antihypertensive that we can choose two drugs from the same group, which is what? Diuretics. Diuretics are just water pills. They increases urine output. So we have types of diuretics. We have loop diuretic, we have potassium sparing, we have thiazide, we have osmotic. Those are the most common types. So furosemide can be used with spironolactone. Here is why. Furosemide causes the excretion of both sodium and potassium. That is why it's very good for you to check your potassium level before administering furosemide. That's a loop diuretic, you understand? It's not a loop diuretic. So when it comes to furosemide, after checking your potassium level, you have to ensure that this patient doesn't have hypersensitivity. You have to ensure that this patient is not dehydrated. You have to ensure that this patient is not having hypotension. Things to note when giving furosemide. So here is why we combine it with adactone, which is a potassium sparing. You know, furosemide causes the excretion or elimination of both sodium and potassium. So if you are giving it only to somebody that is already having low potassium, that's hypokalemia, you are already worsening the situation. So you now add potassium sparing diuretics, which is what? Adactone. Why this furosemide is removing the sodium, the potassium sparing diuretics, adactone is causing the is antagonizing the effects by making what? Stopping the excretion of potassium. That's why we combine both furosemide and adactone together in management. As simple as that. So here are other things to note. Furosemide also causes what? Ototoxicity. So note, if a patient is complaining of tinnitus during management, you have to what? Discontinue or adjust the dose. So if a patient is having hypotension, that's low blood pressure, you have to what? Take precautions. You have to weigh your patient daily when you are giving furosemide, because it causes dehydration. It causes excess removal of fluid in the body. Thank you.